Assistant Professor at King Edward Medical University, and I'm your moderator for this session. About 422 million people worldwide have diabetes, the majority living in low and middle income countries, and more than 1.5 million deaths are directly attributed to diabetes each year. Both the number of cases and the prevalence of diabetes has been steadily increasing over the past few decades. New drugs and new advancements obviously have changed the face of some chronic illnesses like diabetes and hypertension. Let's dig about it more about diabetes and new strategies in our session. So we will start our formal session with the introduction of our chairperson, our co-chairperson, and our panelists for this session. Our chairperson for this session, Professor Bilal Mohyuddin, who is a renowned cardiologist. He is MBBS, FCPS Cardiology, Fellow of Pakistan Society of Internal Medicine. He is Professor of Cardiology, currently serving at Fatma Jinnah Medical University, Lahore. He is former Executive Director, Punjab Institute of Cardiology, Pakistan. We welcome Dr. Bilal Mohyuddin as chairperson of this session. Our co-chairperson for this session, Professor Tariq Wasim. He is highly esteemed and skilled physician, having a degree of MBBS, FCPS, FRCP London. He has advanced medical expertise in the field of general medicine, and he has served at all the renowned medical institutes in various capacities. He is Senior Vice President, Pakistan Society of Internal Medicine. Let's welcome Professor Tariq Wasim as co-chairperson of this session. So moving on to our panelists for this session, we have Dr. Upal with us as a panelist. Dr. Upal is MBBS, he is MD, FCCP and FRCP Edinburgh. He is President-elect Ceylon College of Physicians. He is Consultant Physician, National Hospital of Sri Lanka. He is former Secretary Board of Medicine, Postgraduate Institute of Medicine, and member of Presidential Task Force for Dengue. We welcome you, sir, as a panelist for this session. Our next panelist, Professor Tajam Sheth. He is a renowned physician. He is diabetologist, professor of medicine, serving at Sharif Dental and Medical College, Sharif City Hospital, Lahore. A very warm welcome to you, sir. Our next panelist for this session, none other than Dr. Haroon Bilal, who is internal medical specialist with an experience of more than 20 years. He is FCPS medicine and currently serving at DHQ Hospital, DG Khan. Thank you so much to our chairpersons and panelists for this session. Sweet is sweet, but until it is not too sweet. So as the spoon of diabetes challenges the global population, diabetic organization across the globe call for unanimous resonance of diabetic voice to tackle the diabetes with healthy living and with different strategies. With the discovery of new pathophysiology associated with diabetes, the patients are gaining access to neurotherapeutic regimes as well. So moving on to our first talk of the day, which is about beyond the scales emerging strategies to improve the metabolic outcome for people with diabetes with a physician perspective. I would like to have Professor Muhammad Imran Hassan over here. He is MBBS, FRCP Edinburgh. He is FCPS Medicine, MRCP UK, MRCPS. He is well-reputed physician and endocrinologist. He has served at various institutes in different capacities. He is chairman Dengue Expert Advisory Group, currently serving as principal and chief executive Sahiwal Medical College. Over to you, sir.
Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. सर मैंने अपना स्टॉप वॉच स्टार्ट कर दिया. इंशाल्लाह मैं 15 मिनट में ख़त्म कर लूँगा. विटनेसिंग शौकत साहब, मेरी एक रेजोल्यूशन भी होगी कि आइंदा PSIM के जो तमाम मॉडरेशन जो है वो शौकत साहब को दे दी जाए, ताकि सारे प्रोग्राम टाइम पे शुरू हों और टाइम पे ख़त्म हों. सर, emerging strategies to improve metabolic outcome of people with diabetes. As a ground rule, can I suggest to keep your mobiles on the silent mode? Why do we need these sort of presentations? In 2015, I was serving in LGH, and I got to see a patient who was 70, obese, hypertensive, and diabetic. Of course, diabetes was first to come after obesity. She was having stroke, and she had a ICH risk score suggesting that she has 96% mortality. And the only child standing by her side was her daughter. She was 18, and she asked me, the doctor, we have been here for 3 days. Tell me if she's going to survive or not. Otherwise, I can take her home for her palliative care. और मुझे इस बात का पता है that there were, from the history, that there were 2 more sons that she had. Both were addicts, and they were not serving for the family. The father was also a stroke patient. So that's where the importance of controlling the metabolic syndrome comes. Before I start, I would like to show you a video. Please have a look.
Exercise is the most transformative thing that you can do for your brain today. Number 1, it has immediate effects on your brain. A single workout that you do will immediately increase levels of neurotransmitters like dopamine, serotonin, and noradrenaline. My lab showed that a single workout can improve your ability to shift and focus attention, and that focus improvement will last for at least 2 hours. And finally, studies have shown that a single workout will improve your reaction times. Number 2, the most common finding in neuroscience studies looking at the effects of exercise, long-term exercise, is improved attention function dependent on your prefrontal cortex. You not only get better focus and attention, but the volume of the hippocampus increases as well. The most transformative thing that exercise will do is its protective effects on your brain. Here you can think about the brain like a muscle. The more you're working out, the bigger and stronger your hippocampus and prefrontal cortex gets. Why is that important? Because the prefrontal cortex and the hippocampus are the 2 areas that are most susceptible to neurodegenerative diseases and normal cognitive decline in aging. So with increased exercise over your lifetime, you're not going to cure dementia or Alzheimer's disease. But what you're going to do is you're going to create the strongest, biggest hippocampus and prefrontal cortex. So it takes longer for these diseases to actually have an effect. Good news, you don't have to become a triathlete to get these effects. The rule of thumb is you want to get 3 to 4 times a week exercise, minimum 30 minutes an exercise session, and you want to get aerobic exercise in. That is, get your heart rate up. Bringing exercise in your life will not only give you a happier and more productive life today, but it will protect your brain from...
So in the best interest of time, I'm moving forward. As an introspective, just think yourself, how many of you are at a hill station today? And how many of us have gone in the morning for a walk? So this presentation, this is my disclosure, that this is possible by virtue of unrestricted educational support from FAMIVO. And my objectives are that I'm going to briefly touch metabolic syndrome, diet versus exercise, role of SGLT2 and GLP-1s, and a summary. So what is metabolic syndrome? Accumulation of several disorders which together raise the risk of an individual developing, and here diabetes, hypertension, overweight, obesity, atherosclerosis, and cardiovascular diseases come. So atherosclerotic cardiovascular disease, insulin resistance, diabetes, vascular issues, and neurological complications come. Coming to metabolic syndrome, if I put obesity in the center, presence of prediabetes or diabetes, along with the high normal blood pressure or hypertension, and atherogenic dyslipidemia are important. And all these metabolic syndrome, any 3 of these, like abdominal obesity, elevated triglycerides, low HDL, elevated blood pressure, or elevated fasting plasma glucose, they lead to what is called metabolic syndrome. So becomes a syndrome if the patient has any 3 of the following. 1, a waist circumference more than 40 inches for men and 35 inches for women, elevated triglycerides more than 150 or more, reduced high density lipoproteins, less than 40 for men and less than 50 for women, and elevated plasma fasting glucose levels of more than 100. and blood pressure values of systolic above 130 and diastolic 85 or higher. So for evaluating after a thorough history and physical examination, the evaluation needs to be complemented with laboratory analysis, which include HbA1c to screen for insulin resistance and presence of diabetes mellitus, lipid panel, evaluation for the renal functions, C-reactive proteins, liver panel, thyroid study, and uric acid levels. So, what about diet and exercise? So, modifiable factors such as diet and exercise should be emphasized in patients with metabolic syndrome. And if I say that it's just like 4 tires of a car, then probably the first tire is your good diet, the next is your exercise, the third one is the medication which you are going to take, and the fourth one is the stresses in the life which are going to affect. So for a good diet and exercise, behavior therapy is very important. And then along with that, the lifestyle changes, including a healthy diet, exercise, underlying risk factors can be decreased, like obesity should be targeted, dyslipidemia should be reduced, hypertension and hyperglycemia should also be reduced. And this will lead to decreasing the risk of diabetes, decreasing the risk of metabolic syndrome, and decreasing cardiovascular risk. And ultimately, it will lead to a good quality of life and a better life expectancy. So here, if I say that in this picture, if you see that aerobic exercise is very important. And here you can see that aerobic exercise along with dietary restriction, whether it be in the form of restriction in any other way or intermittent fasting, because alternate day fasting or 5-2 diets or time restricted feeding, they are all basically going to have a synergistic effect on the patients. And this will reduce obesity, control diabetes, it will decrease fatty liver as well as decrease the cardiovascular risk. So abdominal obesity is one of the most important part when we are talking of obesity. And if we can see here that mainly hypertension, prediabetes or diabetes, and erythematous dyslipidemia, they all can lead to different abnormalities like affecting kidneys, liver, heart, obstructive sleep apnea, polycystic ovary syndrome, sympathetic activation and tachycardia, hyperuricemia, and chronic inflammation. So everything is going to get better if we can try and reduce the abdominal obesity. So what are the different diabetic drugs which are available in the market? And when we are talking of drug, the list is exhaustive. And I'm just going to target just few of them. So an anti-diabetic agent, which like peroxisome proliferator, activated receptor gamma, or insulin sensitizing agents, or glucagon like peptide 1 receptor agonists, or GIPs, or glucagon, or DPP4 inhibitors, or sodium glucose cotransporter inhibitors. So when we are talking of therapeutic approaches, then GLP and GIP, they are very important drugs. And in addition to that, the fourth one, glucagon, is now documented recently in literature in so many studies that it is probably in the future for the patients with diabetes as well as obesity. So obesity is a chronic, treatable neurometabolic disease that is projected to affect nearly a quarter of the world population by 2035. These two drugs, they are present with us, semaglutide and dulaglutide, and they are already being used. There is a very slight difference because both of them belong to the same group, just GLP-1 inhibitors. And for GLP-1 inhibitors, once a week, they are very convenient drugs. I have a tongue twister naming all these medicine. Tirzepatide, now in phase 3 trials, the obesity treatment is with this drug is transforming. Eli Lilly is continuously doing trials for this drug. It is a combination of GLP and GIP, and the results are much better than the GLP-1s. Similarly, this new drug is already been few weeks back. Retatrutide phase 2 trials have been published in NEJM, and it is a combination of GLP, GIP, and glucagon. And the results are far better than even tirzepatide. So the body weight reductions, which were documented at about maybe 7 to 10% with just GLP-1s, they are now documented at somewhere around 26% with a triple therapy. So talking of SGLT2s, it's a combination of so many things, reducing stress and inflammation, blood pressure reduction, heart failure benefits, reduction in triglycerides and lipolysis, glycosuria causing renal protection, increased glucagon and decreasing insulin and glucotoxicity, and similarly hepatic glucose output increase with increase in the ketogenesis. These all benefits are documented with even every sister drug of SGLT2 which is present in the market today. We can debate along which one is better, but every sister drug has similar effects. So Diabetes Management Guidelines 2023, you can see here that after lifestyle and the glycemic target should be individualized. If atherosclerotic cardiovascular disease, then which drugs should be given? Heart failure, you can see SGLT2s are the drugs of choice. For stroke, GLP-1 or pioglitazones. And similarly for CKD patients, SGLT2s and GLP-1s are the drugs of choice. And the ADA and EASD consensus guidelines suggest that, this is a very busy slide, but just for one thing, the compelling need to minimize weight gain and promote weight loss. You can see here that just 2 drugs which are present here, GLP-1 and SGLT2, and they are just using them. If one is started, the other one is added. It's almost the same. Which one is started first? It depends on what is the patient's pocket allows. So for summary, lifestyle modification, most important, diet and exercise. This is 50% treatment for my patients. Metabolic syndrome, all 3 are important. And I'm happy that as a brainchild of Dr. Tariq Wasim and Dr. Somia, that triopathy is being launched as a course as well. How to evaluate? You have to check A1C, lipid profile, LFTs, uric acid and renal profile. And how to manage? It should be an emphasis on diet, intermittent fasting, exercise, and the treatment include all these drugs which can be given. So thank you very much, but before I conclude, I would like to pay a tribute, because I learn from not only from my teachers, there are so many teachers sitting here, but I also learn from all my colleagues as well as my juniors. There are juniors sitting here who have worked with me as well, so I learn from you a lot. So this is just a tribute for all of you.
गुड मॉर्निंग प्रिंसिपल मैडम.
Oh, good morning, Murthy sir. How are you?
बस मैडम चल रहा है. एक्चुअली आपके साथ सिलेबस के बारे में कुछ बात करना है मैडम.
Murthy sir, आपकी क्लास का टाइम हो रहा है ना? Can we talk about it later?
ओके मैडम. Did I come to the wrong classroom?
No, sir.
आज पेरेंट्स टीचर्स का मीटिंग है क्या?
No, sir. Ritvik Reddy. Murthy sir's class batch of 2003. Sir, you taught me the importance of foundation. That's why I'm a civil engineer today.
Devika Ramchandran, Murthy sir's class, Sri Chaitanya batch of 2018. I was very tensed before my JEE advanced, but you helped me get through it, and today I am an IITian.
You taught me the value of serving others, and that made me an IAS officer.
I'm a DRDO scientist.
Sri Chaitanya Principal, Jyoti Sharma. Mr. Murthy's class, Sri Chaitanya batch 1992. Your first student, sir. पिछले 30 सालों में you have changed countless lives, sir. But we never got a chance to say thank you. So we thought, thank you for making us who we are. Happy Teachers.
Thank you very much, and I would end by giving one more suggestion. I don't know whether that PSIM should also, sir, my request is to give tribute to the senior professors' lifetime achievement, something like that should be also be announced. Thank you.